Okay, we're now recording. My name is Dan Grego, your videographer. I represent Trailer Productions. I'm not financially interested in this action, nor am I a relative or employee of any attorney or any parties. The date is the 7th of March, 2016. Time is 1:35 p.m. Deposition is taking place at the office of Dr. Robert Wilson. Case number BC 519492. And the deposition is obviously taking place at the office of Dr. Robert Wilson. Your court reporter is Kathy Jackson with Atkinson Baker. Counsel's going to introduce themselves and then we're going to go on the record.
Armin Tostian, attorney for plaintiff Michele Mauricio.
James F.P. Sawyer for defendants.
Raise your right hand, please, doctor. Do you solemnly swear the testimony you'll give and the following proceedings shall be the truth, the whole truth, and nothing but the truth?
I do.
Thank you so much.
Certainly.
Please state and spell your name for the record, sir.
Sure. Robert, R-O-B-E-R-T, Wilson, W-I-L-S-O-N.
Dr. Wilson, have you used any other names in your lifetime?
No.
You've been designated as an expert witness in orthopedics on behalf of Peter Service, Inc., correct?
I would know on behalf of who, but yes, I believe in this case on Michele Mauricio, I've been designated as an expert.
I'm sorry, I didn't understand that answer. Can you clarify?
I don't recall, I don't know whatever name you said because I wouldn't know who that is, but I have been designated an expert in regards to this case as far as I'm aware.
On whose behalf are you an expert?
Don't know, whichever the firm is, I assume, I don't know. I'm just saying I don't recognize the name, I'm not sure the name you use, so it's Pollard, Mavericks, Crawford are the attorneys.
Okay, so you do not know the name of the party that, on whose behalf you've been retained?
Correct, I haven't memorized the name of anybody else.
No. Okay.
I wouldn't be aware of any other names.
No problem. I have a notice of deposition which I sent to my opposing counsel. Did you see the notice of deposition by any chance?
My office would handle that, but I made a copy here for you of the chart, so here's a copy of the chart. The other ones, the medical records I reviewed. I think some may have been sent back, but all the ones that related to orthopedics are here, and I gave you my CV already.
Non-responsive objection, move to strike. Doctor, did you see a copy of the notice of deposition?
I already answered you that my office would do it, and they'd go through it. I don't know if I personally saw it or not, but they would take care of making copies of everything.
Again, non-responsive, move to strike. Doctor, did you personally see the notice of deposition for the third time?
I've already answered as best I can. That's my answer.
Either yes or no, sir. Did you see it or not?
I've given you my answer.
You haven't, sir. You said your office did something. So
Okay.
I don't know who
Would you
your
like to have the
office
court
is.
reporter read it back for you, but I stand by my answer.
Okay. Let's have the court reporter read this deposition, the testimony back on this question. And by the way, doctor, I was told just before the deposition by your assistant that we're only here for 1 hour. I may have much more than 1 hour. Do you understand that?
If it's just a little bit, I'm fine to do. If it goes too much further, I do have patients and things we might have to do in two sessions, but I'd be happy to make myself available.
Doctor, you knew that today was your deposition, correct?
I know that I had deposition, yes. It was scheduled for 1 hour in my office. I'm doing it during my lunchtime, so I have patients both before and afterwards, and I'm happy to do as much as I can. It was done at this time for somebody's request, so we'll make myself available. We'll try to get as much we can. If it gets way beyond there, I do have patients and people to see. You have your choice. You can wait till I'm done, or you can reschedule. But I will make myself available.
Doctor, you charge $875 an hour, correct, to make
Okay.
yourself available?
$875 for doing a deposition, that is correct.
Okay. My time is equally valuable. It may not be $875, but it is also valuable to me and to my client. So the notion that you are expressing that I can wait until you're done with your day's business for me to continue your deposition is not going to be accepted. if we're gonna continue this deposition, then I'm gonna expect you to come to my office. Do you understand that, sir?
Again, I wouldn't be able to tell you anything, if whatever needs to be done, I'm just saying, I'm trying to make it work for all of us, so maybe if we got on with the questions, we could probably get it done on time.
Is there a reason why your office did not tell me that this deposition was only set aside for 1 hour today?
Whoever called and scheduled it, they would have been told that, they would have been asked how long the deposition was for, so it would be, some people booked 2 hours, some people booked 3 hours. It was booked as 1 hour, so that helps me put it in, and especially when people say, can we do it on a specific date, then they'll say, yes, well, instead of lunch, he'll be happy to do the deposition. But if you wanted me to cancel the whole afternoon out, that would be a whole different thing, so obviously, I have to know how long people expect to go. So had you scheduled it, knowing that you have a huge amount of questions, had you said, I need 2 hours or 3 hours, my office would have accommodated you.
Sir, how many depositions have you testified in your lifetime?
Don't know, hundreds,
300, 400?
probably.
Okay. And have your depots always gone for 1 hour?
Vast majority, yeah, 90%, more than 90% go within the hour, so it's rare. Many of the other ones have been scheduled. There are ones that have gone, people didn't finish in time, and then we've had to continue it. That's happened also.
Isn't it true that for the past several years now you've set up a practice where your manager comes and knocks on the door on the dial of the 1 hour and says you have other matters to attend and you cut the deposition short?
Well, of course, if there's other things done at the end of the time, she's gonna come and let me know, because other things are scheduled.
Okay. If that happens today, I'm gonna reserve my right to make a motion to exclude the entirety of your deposition. Do you understand that?
Well, she of course is gonna knock at the end of an hour if that's the time. If you need to go, if you're close to being done, I'll be happy to stay. I've already made it clear. I have patience. I will be happy to go as long as I can. The more we can get off this topic to something else, I think is much more important for us. If you're close to being finished, I'll make everybody wait. If you're gonna take hours longer, I can't do that. I would have to reschedule, or you could wait till I'm done. It'd be your choice. I'm happy to do whatever works best for you within the constraints that I've told you about.
I highly doubt that, sir, but do you understand that I
I don't
reserve
need your
my right?
attitude, you know, you're being really inappropriate in this. I'm here to help you get it done. I don't need your comments about that. I don't need you having this insinuation or whatever. We're here to be professional. Can you please just ask me the questions? I'll be happy to answer them to the best I can. We already spent a huge amount of time on this, which is not really necessary, so let's go on with what questions you have.
Objection, non-responsive, move to strike. Sir, do you understand that I reserve the right to make a motion to exclude your testimony if you walk out of this deposition before it's concluded today?
I'm not walking out of my office, but if I have to see patients, I'll be seeing patients, and then you can wait, I'll come back. I've made it very clear what I will do, made it very clear how we can proceed forward. I feel you're just stalling now, but I'd suggest we go on with our questions.
So you're not going to answer my question?
I have answered the best of my ability. I don't know what you're going to do or not going to do. I can only tell you what I can do to help you out.
All
I'm
right.
here to make it so we can all get through this.
Just
There's no
a yes,
reason we can't
Dr.
be-
Wilson, just a yes or no. Did you see the notice of deposition?
As I've already answered, I'll answer it one more time. I don't recall whether I've seen it or not. I've seen many. If it came weeks ago, I could have certainly seen it. If I see it, I turn it to my office. I say, please make copies of whatever we have that does it. So I've already answered that.
Do you care to go through that notice, sir, or no?
If you'd like me to, but I have brought my entire chart. I've brought what I have. So,
Okay, the notice requests that you produce your 1099s in relation to your income that you earn from doing forensic work. For example, personal injury matters, workers' compensation matters, anything that you earn from litigation-related matters. Do you have your 1099s?
no, I don't have my 1099s. I don't deal with those. Those go to my accountant.
What's your accountant's name?
I'm not giving you my accountant's name. My accountant does all my personal stuff and everything else. I'm happy to talk about what percentage my practice is medical legal. I'm happy to talk about how much money I make as a med legal. I'm happy to give you approximations of any of that, but I'm not going to talk about any part of my life that has nothing to do with the med legal issues.
You're refusing to turn over your 1099s?
I'll object on grounds of relevance, not reasonably calculated to lead to the discovery of admissible evidence. Please move on, counsel.
Counsel, under Stony Brook case, I'm entitled to know how much income doctor earns from forensic work. That goes to his bias in terms of certain, industries that he's working for.
He's already stated he's willing to answer such a question. Why don't you ask it?
Doctor, are you refusing to turn over your 1099s?
One, I don't have my 1099s. Two is I wouldn't be turning them over to you anyway. Three, I'd have no way of knowing which 1099s have to do with whichever cases are med legal or not med legal. I'd have no way of knowing that. So I will not be turning any of my 1099s over to you for those reasons.
Will you be willing to sign an authorization to give to your accountant so he can give us the 1099s that you earn from doing defense work with regards to legal matters?
Same
Workers'
objection.
compensation, personal injury, etc.
Same objection.
No, I won't be dealing with anything other than as it does to this case or to med legal. I'll be happy to give you an approximation of how much income I make during this. I'm happy to do that. I've been asked that many times. And I've been doing this 30 years. I've never turned over 1099s in 30 years, and I don't have them, and I would not be turning them over.
You have filed your tax returns with the court in your dissolution case, did you not?
I'm again not talking about
Objection.
anything that doesn't have anything to do with medical legal issues. I
Same
won't be
objection.
talking about anything to do with my private life.
Doctor, you have actually previously provided declarations under oath in court proceedings with regards to your income, have you not?
Again, I'm not going to answer anything regards anything else other than medical legal issues, which I'll be happy to tell you my approximation, or anything to do with this case. I will not be going into anything of a private nature, anything about my life other than in this.
Okay, all right. We're gonna mark depot notice as exhibit 1 for the record. Okay, depot notice also requests you to produce your chart. Do you have your chart?
Yes, I made a copy of the chart right here for you. And these are the medical records, some of them I reviewed. If you would like to have copies made of this and bring it back to me, that's fine, whatever you would like.
So the copy of the chart that you just handed to me is consisted of your report dated January 11, correct?
2016, yes.
Anything else other than that? Can you tell me what
Well,
the
first
notes are?
Well, there's a typed orthopedic exam and consultation, which is 11 pages, which has to do with the report to my exam, discussion section, etc., regarding Mr. Maurizio. I also have a listing of the records I reviewed, dated January 11th, 2006, titled Review of Records. Then I also have my handwritten exam sheets, both the history and the by my historian, by myself, as well as the physical exam notes made at the time, which I've made copies for you. And then I have the cover letter from the attorneys, which I made a copy for you.
When did you turn over the review of records to Mr. Sawyer's office?
I wouldn't know, generally it takes me less than a month. I'm always within a month, generally. Sometimes usually, if I don't have to make changes, it can be within 2 weeks. That's my turnover time. Generally, by the time I dictate, get back from transcription, make corrections, get it sent out, it's somewhere between 2 to 4 weeks on average.
I appreciate you telling me what you do on average. My question is more specific. When did you turn it over to Mr. Sawyer?
I wouldn't know other than my approximation as I gave you.
Okay. Did you turn over the review of records alongside with your orthopedic examination and consultation?
I would assume they were sent at the same time. I would not know personally.
Who would know?
I don't know whoever put it in the envelope. I would assume it was done. Would not know. I sign it. It goes to individuals in my office. They address it, mail it. They send it out. It's not something I get involved with.
I'm gonna mark the chart as exhibit number 2. Actually, the chart copy that the doctor handed to me. And that file in front of you, doctor, what is it? Can you tell me what it contains?
Everything on the right is what I just made a copy for you. Everything on the left is the records that were sent that I, at least if there's non-orthopedic or other ones, I may send back ones, but other ones would all be here, as well as all of this here, as well as my CV, and as well as these are all the multiple MRIs and films and everything else I reviewed.
Okay, if you would like to remove those items from the right side, you can do so. I'm gonna mark everything else, for the record, I'm gonna give it to the court reporter for copying.
I'll do it the other way, I'll take it from the left side and keep my chart here. I'll be happy to do that for you.
Counsel, will that be exhibit 3?
Let's see. All right. The items that we just removed from the left side of the doctor's chart, which is medical records, correct?
They are, yes. they're
Those are
medical
also
records.
medical records, doctor?
Correct.
Is it part of the chart?
I don't know, I just received these recently, so, don't know if they are, aren't, whatever, but yes, I have them, I'm not sure if they're ones I've reviewed.
I'm sorry, I'm not sure.
I assume those are ones that I have already listed in review records.
I see form interrogatories here involving this case. Did you ask for form interrogatories?
No.
Okay, I'm gonna give this back to you.
Okay.
Okay, the rest of this documents, I'm gonna call it as medical records. Would that be a fair reference, doctor?
Yes.
Okay. It looks like approximately an inch. No. Yeah.
Inch and a half, yes.
Okay, about an inch thick. All right. I'm gonna mark this collectively as 3.
I will get them, when will I get those back?
When the court reporter gets through copying it,
Meaning within a week or two.
I'm hoping so. So
Do
we'll
we
go
have a
ahead
trial
and,
coming up on this?
on the 24th, yes.
So I'm stating, if I'm releasing them to you, then I want to make sure I get them back at least 5 days before the trial.
Well, you'll have them at least 5 days before the trial.
Then that will
All
be
right.
fine.
So we're gonna ask the court reporter to also go ahead and bait stamp this records, okay, ma'am? All right. Can I see the remainder of those paperwork there, doctor, including the ones underneath that folder?
Sure.
Let me see what those are. You're gonna mark this documents, there are 3 pages. One is a blank sheet of paper called File Documentation Log. The other says IME Robert M. Wilson, MD Appointment Card. And the third one says Appointment Confirmation Reminder to Send Medical Records Note. We'll mark this collectively as number 4. Can I see the other documents over there, doctor, please?
Sure. My CD and then this from today.
We'll mark the CV as number 5. And these are your handwritten notes?
Yes.
When did you complete this or do this notes, doctor?
Just an hour before the deposition, a couple hours before the deposition.
Can you read it for the record?
It says 9/18/11, fall, Depo Michael Maruzio, 68 years old, exam 1/11/16, cervical, left hip, buttock, left shoulder, fall, fell 3-foot hole, paramedics, right eye laceration, nose broken, no loss of consciousness, no neck, no back, Pomona, left forearm, wrist, hand, nasal fracture on CT, Methodist, 9/23/11, syncopal episode, MRI 1/14/12, cervical spine, MRI 9/19/12, cervical spine, 9/22/11 MRI, CT and neck 6/7/13, degenerative changes, MRI 6/13/13.
Okay, we'll mark that as next in line.
I'll make a
number
copy, I'm gonna
6.
keep that inside my notes, I'll be able to make a copy for you.
All right,
Attach
so
the copy at the end.
attach the copy, not a problem. And this here is your billing statement that you handed to me before the deposition, correct?
That's correct.
We'll mark this as number 7. So in this case, you've billed thus far $3,945?
Correct.
Okay. It says med legal evaluation $995. What's that for?
I didn't do the billing, so I don't know, but, it's $995 is the charge to the med legal. And then there's a review of radiographs for $1250, which would be all these multiple films here on the CDs, multiple MRIs. There's another charge of $500 for that, and then a later review of records for $1200. So that would be the different charges.
Okay, so $995 is for what exactly?
Exam on Mr. Mauricio.
Got it. Review of radiographs, it says 1/11/16, $1,250. How many radiographs did you review?
Hundreds. There's hundreds of individual films.
For Mr. Maurizio?
Yes,
Okay, can you tell me the date of those radiographs that you reviewed?
it's all listed on my report. I gave you a copy.
Okay. You had another $1,200 for review of records, and another $500 for review of radiographs. So in total, you charged $1,750 to review the MRIs and X-rays and CTs and so forth?
That is correct.
Okay. So did you review the reports or the actual, images?
No, the actual films,
Okay.
as well as the reports, but
Okay. How many MRIs did you review in total in terms of the dates of those studies, not the number of films?
they're all listed, starting on page 6 and continuing on page 7 of my report.
Did you review any MRI reports that were done in 2014?
Again, everything I reviewed is listed, so under the review records section, I've
Well-
listed everything I reviewed.
I prefer to hear from you, sir.
Again, I'd have to go back and do it. I'm not gonna, there's so many, I'm not gonna go by my memory of what dates I saw which ones, so, everything I've reviewed is listed.
So
No,
as you sit here today, you don't know if you reviewed any MRIs in 2014?
I don't recall any, I can tell you that. I recall most of my cell was all 2011, 2012, so there's none I recall, but I wouldn't wanna state definitively without going back and to see if I reviewed one. If I did, it's listed.
How about MRIs done in 2015?
I don't recall any, as again, same answer, I recall a number in 2011 and 2012, I don't recall any after that date, I think there was a CT of the neck in 2013. But yeah, here, it is, I did see MRI films, right, page 6, third paragraph down, May 6, 2015.
Was it just a cervical spine or lumbar spine also?
That was cervical spine.
All right, so you did not review any MRIs dealing with lumbar spine, true?
Don't recall any, again, I wanna go look through and make sure, because there's so many, as I said, there was literally hundreds and hundreds of films. I know I saw a lot of CTs, I know I saw films of the shoulder, MRIs of the cervical. I don't see anything about the lumbar that I recall sitting here today.
4, 5, 6. I just counted 6 discs or CDs containing radiographs, MRIs, CTs, X-rays, I guess. Are there any other films that are not here aside from the 6 discs that we have?
I believe that's all.
Okay. And all the images that you reviewed were contained on discs and not actual films?
As far as I remember, I don't believe there was a package of X-rays. Nowadays, it seems mostly on CDs.
Okay. We're gonna mark this 6 CDs collectively as exhibit number 8.
Again, as long as I get those back within 5 days of trial.
Doctor, how much money do you make doing forensic work?
Don't know the exact number, so it's based on approximation, based on the number of patients I see and everything else. It's probably about $400,000 per year.
All right, let's talk about the physical examinations, or med legal as you refer to. You charge $9.95 for those?
Yes,
And for record review, how much do you charge?
well, initial bit of record view is in there. After that, it's by the inch, so it just depends on how many inches of records.
I prefer a dollar amount to know what you charge.
Well, I don't do the billing, they do it based on the number of inches, but, so I think it's maybe $200 an inch or something. I'm not quite sure exactly what it is, but they actually look at how many inches of records there are.
Do you charge by the hour at all?
Not only for court or depots, everything else is set on a flat fee.
All right, so initially you get contacted to do medical legal work and you get some records. For that initial review, how much do you charge?
Well, if there was just a small number of records, it'd be $9.95. That includes the first part of the records. If there's substantial records, like in this case, then there could be additional charges. I think there was additional, is it 500 you said for the billing, means that it was more than a half an inch. Then if there's films, radiographs, again, those based on how many films they are. So again, if there's hundreds of films, they will be charging commensurate with that.
So let's say you get a few films and about an inch thick of medical records, how much would you charge for that initially?
Like on average, most of the ones, maybe it'd be $9.95, maybe it'd be $2.50 for the review records. Could be on average. A lot of them that don't send films, but if they do send films, if they just sent me one MRI, two MRIs, it'd probably be $2.50, something like that. Some don't even send any. This was a lot more voluminous than the majority are by far.
In the past, you've testified that about 90 to 99% of your work is on behalf of the defense. Do you recall giving that type of testimony?
I can tell you what it has been. It's been about 80% or so for the last number of years, so it's been about 80% defense.
How many years?
Don't know. We'll go back by memory too long, but it's been that way for a while.
What's while?
Years. I don't know how many.
2 years?
At least.
5 years?
Again, I'm not going to go by memory back before then. As far as I recall, it's usually been about 80%, sometimes up to 90% defense. That's how it's been for the majority of the time, but there could be years, could be a year period in there that was more or less. So again, it's based on an average.
Okay. Have you testified on behalf of a plaintiff this year?
In the last 12 months, yes.
Well, let's limit it to 2016 for now.
No, I've only testified a couple of times so far this year, but I don't think any of them are plaintiff.
Okay. In 2015, did you testify on behalf of a plaintiff in a court of law?
Yes.
How many times?
Don't know. Probably at least 3, but I don't know exactly.
Which courts were those,
I don't know.
location-wise?
One was Van Nuys, I think. One was Long Beach, I think. One was somewhere in Inland Empire, I believe.
What were the lawyers' names for the plaintiff's counsel retaining you?
I think one of them was Brown. One of them, I saw one, I think it was Shigarian. Don't know which time frame, which one. I know in the past I've also testified for attorney named Karen, and there's other attorneys.
Do you know Brown's first name?
No. Probably know any of these first.
How about Karen's full name?
Don't know.
Do you recall the patient's name on whose behalf you testified?
No.
Were there your patients, or you were retained as an expert witness to go and give an opinion?
Retained as an expert.
Okay. Shigarian's case, was it a personal injury case?
I don't remember what it was, I just know I was testifying for them, I was hired, he's the attorney, I don't recall the details of the case.
Do you know they don't do any personal injury work?
Again, I don't know, I just know that I've worked with them, I know he sent me patients, I know that he's a plaintiff attorney, so these are plaintiff attorneys I've worked with.
Do you know that he only practices employment law?
That he was the plaintiff on employment law. I think you can turn around and sue your employer sometimes, even outside of work comp. I know that they've done that, so it must be someone suing their employer thinking they had an injury. Whilst would they hire me, I would assume it must be orthopedic.
So was this that type of scenario where the patient that you testified for had a workers' comp case?
I don't know.
Or was it injured during employment of some sort?
Again, I don't recall the details of the case, so I don't want to speak on something I don't recall the details of.
And this was in 2015?
I believe so. I know I've dealt with them. I don't know exactly the different months. As I said, I know for sure I've testified 2 or 3 times on plaintiff cases in 2015, but I wouldn't want to go by my memory of exactly which case was which.
Do you have any record of that?
Of course, if I have a chart on somebody, I would have a record by having the chart.
My depo notice requested that you produce those records that you've testified. Do you have any records to produce today?
No, I don't keep a list, so there is no such record.
Okay. How much do you charge to get to testify in court, sir?
It's based on the same $8.75 an hour, depending on how many hours, so it's probably $4,000, $5,000, depending on where it is and how long I've got to schedule out of the office.
You reserve 5-hour minimum for that, correct?
Depends on where it is. Again, I don't do the billing, but I would assume that it's somewhere in that range.
How many medical examinations for legal purposes do you conduct per week,
Varies.
on average?
I think I'm doing 3 this week. I don't know. Someone asked me, so I counted in January. I did 14 in January, but that was sort of a busy month, I think. But certainly, there's other months that I don't do that many.
How many would you do in a year per average?
Don't know. I don't keep track other than what I've told you.
So on average, you do about 3 a week?
There's other weeks I don't do any, so I don't know that that's an average, but there certainly are weeks I've done 3, but don't know if that's an actual average, but I probably do somewhere, around more than 130 or 100 and some odd number per year, but I don't know the number.
How many workers' comp cases do you do examinations per week approximately?
A lot of my practice is work comp. In clinics, I see 20 people in a day that are all injured workers, so that's a whole different part of my practice.
On the applicant side or on the defense side?
Well, they're injured, they got hurt at work, they need surgery, so I treat, so I don't do clinics where I determine if they need surgery, and if they need surgery, I do the surgery, so.
What I'm trying to understand is that you're seeing them as someone who's retained by the insurance company to conduct examinations, or they come to your clinic to receive medical care.
To receive medical care.
Okay, so what percentage of your practice is workers' comp?
A large percentage, I don't know.
80%?
Probably not that high, but, majority of the treating I do is, a lot is work comp.
Would you say 75%?
I wouldn't want to speculate, I don't know the exact numbers, it depends, certainly some weeks it is 70%, other weeks it's not, but I don't know overall, but majority, meaning more than 50% of all the people I see are probably got hurt at some level on the job, so they're injured workers.
Do you do surgeries?
Yes.
And you don't operate on spines, do you?
I assist, I don't do lead surgery anymore, I dropped the insurance for it, but I just had a spine case last week and booked, and I had, I do 7, 8 a year. I'll assist some of the patients I do, some I just assist because they like having assistance.
How long has it been since you've stopped doing spine surgeries as a lead surgeon?
More than a decade.
Have you ever done any fusion surgeries, neck fusion surgeries?
Well, I've been involved in dozens, wouldn't know the different ones, but yeah, the most common one we do in the neck is a fusion surgery. I've done 3 or 4 this year.
As
Meaning in the last
an
12 months.
assistant surgeon?
Correct.
Okay. As a lead surgeon, have you done any neck fusion surgeries?
Oh, I'm sure I have, I don't know which cases, but yes, I've done fusions of almost every part of the body.
And you have no recollection, when was that you did fusion surgery on a patient's neck as a
As I
lead
said,
surgeon?
I've done so many, be trying to
10 years
when
ago?
the only difference to me is the billing, if I'm assisting or not, would be, I did them with the same doctors. I used to do a whole bunch with Dr. Lamon, and sometimes I was the surgeon and he was the assistant, so billing wise, then later on I told him I'm no longer going to be the surgeon. From now on, you bill as surgeon, I'll always be the assistant, but everything else was the same. So the only difference is in the paperwork. So other than that, we did the exact same surgeries we've done for 20 some odd years together. So I wouldn't be able to tell you billing wise. I can tell you the cases I've been involved in, as I told you.
As a lead surgeon, when was the last time you did a neck surgery for someone?
And for the final answer, because again, you keep going over this, I don't know, it's been more than a decade.
Thank you, I appreciate that. Have you ever worked with the law firm of Pollard Mavrodakis Kernair?
Is that this firm?
Forgot the last one. Crawford. Thank you. Yes, that one.
Yes, I have.
How many times?
Don't know. I know I've worked with the attorney here before in the past, but
More than 100 times?
no, nothing like that, but know that I've worked with them
Couple of dozen?
probably over 20 or 30 years. Yeah, as I said, I think I've worked with them for more than 20 years. First met the other attorney a long time ago.
Who contacted you about this case?
I wouldn't know. You have you took my phone log thing. It would tell you on that. I don't even know.
Exhibits are all right there. Feel free to.
The blue little sheet. You
Oh,
took
the
the
blue little
little
sheet.
blue sheet that has the initial phone.
Okay, there you
It says here that on 11/6/2015, Attorney James Sawyer called to schedule the appointment with Mr. Morzio for December 2015.
go. Well, why don't you state all of your opinions so that there are no surprises in trial?
Well, as you're aware, I don't go to court to state my opinions. People ask me questions, so I can anticipate what the questions I think would be. I'd be happy to give them my opinions. But as I said, Mr. Maurizio was seen initially following this event, initially by the paramedics. He had the abrasions, the right eye laceration. He's been seen in the emergency room.
You had a broken nose too, correct?
He did. I'm just going over the paramedics. They wouldn't know that it was broken, so the first one was the paramedics. Now we get to the emergency room, we do see that he had not only facial contusions, laceration, but we get the x-rays, and he has a nasal fracture, which we can see. He was complaining pain in his left forearm, left wrist, left hand, as well as the nose and face. So he has injuries consistent with all that. He later gets an MRI of the cervical spine, which shows some diffuse degenerative changes. Findings in MRI wouldn't be due to this event, but I think he could have gotten some exacerbation of some prior degenerative changes. That he may have been symptomatic, especially the first few weeks, and benefited from care and treatment. I have no problem with him getting some initial therapy, 8, 10, 12 visits, especially the first couple months. And, I think that, he was seen a few days later with neck pain, saying he had a syncopal episode. Again, it's not going to be related to this, but could have had whatever happened at that point. I think he's later seen for, talks about this history that he couldn't move his arms and legs. I know he gives that that's actually not what we see in emergency room records, it's just he had strange feeling about his arms and legs, but he has a history of ethanol use and could be hyperventilating and a bunch of other things will cause that. There's certainly nothing on the MRI of any recent acute traumatic things, but I think he may have had some exacerbation. EMG studies do show he has some polyneuropathy and median nerve compression, which count for numbness.
I'm sorry, he has polyneuropathy.
Polyneuropathy and some median nerve compression and ulnar nerve compression. So again, there's conditions that can relate to polyneuropathy, different medications, ethanol use, a number of things, diabetes, you get the numbness and tingling. None of that's related to this accident, but there would be reasons why he could get numbness and tingling, just not due to this. And I think that, again, any of the reasonable symptoms or exacerbation or soft tissue injuries due to this event are going to resolve within a couple of months. His later complaints aren't going to be due to this event, and that he certainly doesn't need any current or future orthopedic care or treatment due to this event. And when I saw him, he did have findings on exam, some various complaints and decreased range of motion, and late seeing get some tingling, but there's no finding on exam of anything which would be due to the events of September 2011.
Is that the entirety of your opinions?
That's I think a very good thorough summary in my opinions. If you want to go into rationale, reasoning why, talking about why people get degenerative changes, how common it is by the time you're 68, what studies show MRIs in people by 68, what kind of things cause dyspathology, going to any of the, scientific basis for any of those. So all of that's, underlies my opinions, all based on scientific evidence, but it supports the changes we see in him are not due to the events of September 2011.
And what do you base that on?
Orthopedic knowledge, experience in 30 years of orthopedics, knowledge of the literature, knowledge of how injuries occur, what degenerative changes are, what kind of findings we see on MRIs, what causes dyspathology, what causes degeneration, what presentation would be if you did have some acute traumatic finding, how to tell the difference between degenerative changes and acute traumatic changes, what his findings are in exam, understanding what normal is for a 68-year-old individual, understanding what causes polyneuropathy, understanding what EMG studies show, all of that.
You're a member of American Association of Orthopedic Surgeons? Or
Yes.
American Academy of Orthopedic Surgeons? I think they
I
go
didn't
by
know if it was
both
a trick
names.
question there, but no, they only go by academy that I know. AAO, yes, I am a fellow in the American Academy of Orthopedic Surgeons.
Are you familiar with the standards of professionalism of the AAOS?
Yes, I am.
And with the standards of professionalism of AAOS, are you aware of the fact that you are subject to discipline if you give dishonest testimony?
Absolutely, I agree with that.
Okay. And you're also subject to censure if you give dishonest testimony, you know that?
Yeah, they should be. I think they should get dishonest testimony out of courtroom.
Let me show you the standards of professionalism for orthopedic expert opinion and testimony issued by AAOS. I'm sure you've seen this document before, true?
I have, yes.
And there's also expert witness affirmation statement which all fellows are required to sign when they join AAOS.
That's correct, I agree with that.
And you signed one such document, true?
Imagine so, I agree with it.
Okay. Now, it says I will always be truthful. You agree?
I agree.
I will conduct a thorough, fair, and impartial review of facts and the medical care provided, not excluding any relevant information. Would you agree?
Yes.
Okay. In this case, did you test the sensation for Mr. Mauricio?
I did,
How did you do it?
just by him relating if he was intact to sensation.
You only used your fingers to test for sensation, did you not?
That's correct. Once if he's intact, then I don't go further. If he's not intact, then I will go into 2-point things like that and sharp versus dull. But if they're intact, then I don't do it. Also, that's for people who have other conditions other than orthopedic conditions.
You didn't use the pinprick or pinwheel test, correct?
That's correct. I don't do that. If their sensation is essentially intact, I will not go any further than that.
And you didn't do a Hoffman test, correct?
Well, I did, because I do check if there's any kind of myelopathy, which he did not have findings of myelopathy, so Hoffman would be one of those.
Are you sure you did the Hoffman test, doctor?
Yes, I would check for myelopathy.
Is it in your report that says you did the Hoffman test?
No, because he didn't have any findings of myelopathy. I don't list all the other negatives, but he had no findings of myelopathy when I saw him.
So you're sure you performed the Hoffman test?
That'd be part of the standard ones to do, but he had no findings of myelopathy, as I said.
As you sit here today, do you recall performing the Hoffman test on Mr. Mauricio?
Well, as I said, I would do it if there was any indication, and I would always, based on everything on my notes, I wouldn't go by the exact memory of ones. But I can tell you when I saw him, he didn't have any findings of specific myelopathy at that time.
And Hoffman test is one of the significant findings that one can have in an individual who has a cervical myelopathy through.
It's one of the tests. If you have, it's not the significant findings, it's one of the tests for it. So if you're worried about myelopathy, it's one of the things you can look at. There's other ones that are much more indicative of that.
Mr. Mauricio, you mentioned, has some unsteadiness of gait. Did he complain of unsteadiness of gait?
He related in his complaints, as for what I told you, when I saw him, he does have a very slow gait, and he complains of balance on exam, and he relates that he has difficulty, so he didn't use those terms, but he did relate similar type things.
Isn't that one of the common subjective complaints of cervical myelopathy? Unsteadiness of the gait?
It's one of the things you'll do. It's not, of all the reasons people be unsteady gait, cervical myelopathy is way, way, way down there of likely causes. But yes, again, if people can have cervical myelopathy, then it can cause gait changes.
And his MRI reports that you testified having reviewed shows significant cervical stenosis, correct?
He does have some findings of cervical stenosis due to degenerative changes.
Doctor, isn't it true that a person can have a cervical stenosis that can turn into myelopathy as a result of a trauma?
Certainly, if you have a fracture or something else, yeah, you can have one and end up being paralyzed in some people, so that can happen.
As a matter of fact, Mr. Mauricio is at a risk of being paralyzed. Would you agree with that?
But we're all at risk for being paralyzed. The more you have degenerative changes, the more you get older, the more you have multi-level pathology, or risk increases. But it depends more on what your activities are probably than other things, but certainly for all of us, as we get older and have further problems, we will be at a higher risk for certain things.
Doctor, I'm talking specifically about the pathology that exists in Mr. Mauricio's cervical spine. I'm not talking in general terms here.
He doesn't have a high risk, but everybody has a bit of a risk as they get older, especially when they have multi-level pathology. They do get to be at a higher risk. This is not significant or severe. There's not much we would do about that, but yes, as people get older, and yes, as they have multi-level changes, they do have increased risk of having other problems in the future.
So
the majority don't by far, but it can happen.
So the grade 1 retrodisthesis that he has in his cervical spine, you don't consider that to be a high-risk patient for possible paralysis?
Not grade 1, no. If he had further progression or had some other problems, but grade 1 doesn't have that higher rate. But as I said, as you get older and have more degenerative changes, grade 1 is commonly seen. We see that fairly routinely in people as they get older and get degenerative changes.
Doctor, every MRI report that you've reviewed in this case talks about significant cervical stenosis, does it not?
We have cervical stenosis, so it's due to long-standing changes, so no one's arguing that he has multi-level degenerative pathology. There is facet hypertrophy, there is stenosis, there is osteophyte formation. We're not arguing. I'm just telling you that all those changes are not due to events of September 2011, but I'm not disagreeing that he has multiple changes about his neck.
And would you agree that the event that occurred on September 18, 2011, namely the accident, could have caused myelopathy for Mr. Maurizio?
I don't mean by could. You're saying could someone have an event and get myelopathy? Anything's possible. Are you asking is there any evidence that he has myelopathy due to the events of September 2011? No. Is it at all medically probable to any degree that he has any cervical myelopathy due to that event? No.
Have you seen any records that would indicate Mr. Maurizio had myelopathy prior to this incident?
I haven't seen any records prior at all, so I wouldn't have any knowledge of any prior records of any type.
So you cannot rule out to a reasonable degree of medical probability that the myelopathy was not caused due to trauma that Mr. Maurizio had in this case, true?
I wouldn't phrase it that way. I'm not quite sure what you're saying. What I can tell you is he has long-staying degenerative changes that include some stenosis. He doesn't have significant myelopathy when I saw him. That as we get older, anybody can get some. Anything that he does have, even if he has some mild myelopathy now, it's not due to the events of September 2011. And that any myelopathy, as well as all the changes we see on the MRI scans, as well as all the x-rays, etc., aren't due to this accident. That's what I can tell you.
Doctor, a few days after this accident, Mr. Maurizio presented to Methodist Hospital with complaints of numbness and tingling in his arms and in his, pain in his neck. Isn't that the case, sir?
Yeah, he said he had a syncopal episode, that he basically fainted, that he went unconscious. So, again, it wouldn't be due to this event, but yes, he had some kind of event.
And they did a cervical spine MRI, correct?
That is correct.
And they found significant pathology, and which he related to the fall only a few days before that MRI study, true?
No, no one related it to the fall, but those changes are long-standing. I can tell you what the patient may have said or not, I don't know, but the findings in the MRI are not something due to the fall.
Doctor, what did Mr. Maurizio tell the people at the ER in Methodist Hospital? Why was he there? What type of history did he give, in other words?
Medical records speak for themselves. I'll be happy to read from medical records, but I know that he said he had some kind of syncopal episode, but everything else would just be whatever the medical records state.
As you sit here today, do you have any knowledge of that, what he said, besides referring you to the medical records?
No, I go base it on the medical records, not on my photographic memory.
Okay, so you have to review the medical records in order to recall what Mr. Maurizio was complaining about when he presented to Methodist Hospital?
I know he was complaining of numbness and tingling, that he had a syncopal episode, that he had pillow hand numbness.
What was the reason for admission? They admitted him, correct?
Admitted him to, well, I think he had other things, and he had hypertension, anemia, a number of things, so again, the medical records speak for themselves.
All right. Here's something from the admission at the Methodist Hospital. It says final diagnosis, status post fall and cervical spine contusion with bilateral arm radiculopathy and neuropathy. Reason for admission, status post fall with neck pain and arm numbness, tingling and weakness. Have you seen this document before?
Yes, I believe so.
Okay. He did relate to Methodist people that he had a fall, and after that he was experiencing the symptoms, true?
He relates to that fall, that is correct.
Oh,
Thanks.
we're not even close to getting done here.
As I said, I'll leave it to you. If you're anywhere close and you can finish it up in any reasonable time, I'm happy
I'm
to.
not coming back here, doctor. Today's my only opportunity to take your deposition, so if you're not
If I have to go to your office, I'll go to your office. I don't know, that's up to you. I'll be happy to make myself available, so I mean,
How about tonight, after you're done with your patients, I'll have the court reporter to be in my
No,
office.
I'm scheduled tonight, I can't do that tonight, you'd have to schedule with the office. Well, anyway, let's take a break, let me go see what I have, let me see what the things are, and we can, take it from there, let me go find out and see what,
Going off the record, time is 2:30.
Dan, can you read the last question and answer, please?
Did he relate to Methodist people? He had a fall, and after that he was experiencing the symptoms. True. Answer: he relates he had a fall.
The MRI study that was done at Methodist on 9/22/11 showed significant stenosis between C4 and C7, correct?
it did show multiple changes, including stenosis.
Do you know how long he stayed at Methodist Hospital as inpatient?
Again, I would look at the records.
Okay, so you don't recall off the top of your head, basically.
Don't know if they stayed 2 days or not, I would have to look at the records, wouldn't be something I would memorize.
Thank you, Doctor. Dr. Wilson, you said on Dr. Tabor's records that his findings of sensory deficits were dermatomal, correct?
Does not have a specific dermatomal loss, that is true.
It's true that it was cord compression that he ended up with was non-dermatomal deficit, yes?
Don't follow your question.
In other words, let's say if we're dealing with a radiculopathy, you only have dermatomal deficit in the distribution of the root, not with the cord compression, true?
Cord compression isn't radiculopathy, it's myelopathy, two different conditions.
Okay. But when you're talking about lack of dermatomal deficits, we're talking about injuries that start at the distribution of the root, yes?
Again, it's not injuries, we're talking about radiculopathy, you're talking about a specific nerve root being compressed.
So when you have a pinch, a specific pinched nerve, say in the neck or the back, each nerve passes the distribution. When you have a cord compression, you can compress sensory tract such that it may not follow specific dermatome. Is that correct?
Wouldn't phrase it that way, as I already told you. There's radiculopathy and there's myelopathy, they're two different conditions. When we talk about a focal or dermatomal deficit, we're talking about radiculopathy.
So what type of manifestation would cord compression exhibit or show? What would the patient experience if he has a cord compression?
Because of the level of the cord, but for instance, you have significant cervical myelopathy, you tend to get changes lower extremities, hyperreflexia, you get various spasticity, you get all sorts of different changes and findings on exam.
Let me ask you this. Even though you didn't mention in your reports or didn't even say anything like that, frankly speaking, I just want to make sure that it won't come up in trial. You're not calling Mr. Mauricio a malingerer, are you?
I don't make any representation that you can divine out people's truth or whatever. I don't use the name malingering.
Did Mr. Mauricio try to be dishonest during your examination with him?
I can't tell you if someone's being honest or dishonest, but there's obviously discrepancies in his history or the records. A lot of times people recall things differently. I mean, he has the findings on exam. Again, he has multiple complaints which aren't orthopedic, you know, but I'm not saying I can tell what people's truth is. I don't ever make that statement.
Okay, so you're not going to testify in court that Mr. Mauricio is a liar or a malingerer?
I won't be using any terms like that, so no.
Are you gonna be using other terms that will be synonyms of those terms that I just mentioned?
No, I already told you he has complaints that aren't necessarily, of an orthopedic nature. His history isn't exactly as per the records. There's a lot of reasons. So there's various findings on exam that aren't of orthopedic nature, but it has nothing to do with whether someone is lying or their veracity, and I wouldn't be making any statement that I can tell if someone is lying or not lying.
What nature is Mr. Mauricio's complaint, if not orthopedic?
Well, he has a number of complaints. He, as far as, multiple areas, as I'm saying, there's no findings of any ongoing pathology, limitation, or restriction, which is, in my opinion, due to the events of September 2011. So that's the most important portion.
Again, doctor, I'm not sure if you answered my question or not. What's the nature of his complaints? You said it's not orthopedic. What is the nature of his complaints then?
Well, I didn't say he could have some orthopedic complaints because he has degenerative changes and he has findings. I'm not saying he doesn't have orthopedic pathology. It isn't due to the accidents. I'm not following your question. Whatever orthopedic pathology has, all the findings we see in the MRI and the X-rays and things aren't due to the events of September 2011. That's the important thing. I'm not saying there aren't findings. If that's what your question is.
Would you agree that maybe part of his complaints is neurological in nature?
Well, he doesn't have any significant neurological complaints when I saw him. And again, it's his findings, he complains of loss of sensation involving the entire left leg. That's not cervical myelopathy, that's not radiculopathy. He talks about low back pain, but he has the same, with straight legging as with the knee and hip motion. He has different various findings, but when I look at things, he has the same pain with pseudo-twisting. He has complaints about various areas. He has some loss of motion. He has some degenerative changes, and I'm not stating that there aren't positive findings. What I'm saying is he doesn't have any ongoing findings that are due to the events of September 2011. So I'm not trying to say that he very likely may have some complaints or may have some other things. It just isn't due to that event.
He had abnormal findings of his nerve conduction studies, yes?
Yes, he did. He had a polyneuropathy as well as, I think, other findings.
Would polyneuropathy be orthopedic in nature or neurological in nature, the complaint that he has for polyneuropathy?
It is what it is. Polyneuropathy means that you're affecting the nerves as they go down. Common medications can do it. Sometimes age can do it. Diabetes can do it. Ethanol use can do it. There's lots of things that cause polyneuropathy. A lot of medications can do it. So it's something we see. You could see an orthopedist due to the complaints. You could see a neurologist. You could see a number of people due to the complaints. It has nothing to do with events of September 2011 is what I'm telling you.
Mr. Maurizio is not diabetic, true?
Not that I know of, but wouldn't be able to tell you. He said he had no current illnesses, so to the extent I'm aware, he doesn't have any.
So an orthopedic injury can actually cause neurological deficits, true?
There are orthopedic injuries that can cause neurologic deficits. That's absolutely true. Mr. Maurizio doesn't have any due to events of September 2011, but I can give you thousands of examples where people do.
Unfortunately, we don't have time for thousands of examples, doctor. Now, Mr. Maurizio's fall, do you know the mechanism of his fall, how he fell?
Only per what he says as well as the records. I have no independent information.
Are you going to offer any biomechanical testimony in this case?
I'm not going to do any calculations, so no, I'm not going to do any assessment of G-forces or acceleration or what it is off a drop. I mean, there's biomechanics of how you get injuries, that's orthopedics. How do you get a back injury? How do you get a specific injury? What would be the findings? What would be the presentation? What causes? So that, of course, will just go into the overall ones, but I'm not going to do any specific biomechanical calculations other than the normal biomechanics that has to do with orthopedics, which is how you get an injury or how you get degenerative changes or how you get whatever else we're talking about.
Mr. Maurizio told your historian and maybe you also that he fell approximately from a 3-foot distance to his face, correct?
Yes,
He face planted essentially onto the ground,
yes,
and he broke his nose. His teeth were damaged, correct?
again, for whatever his history, but, that's what he states.
From your background as an orthopedic surgeon as well as someone who testifies in biomechanics, would that type of injury cause neck injury?
Not necessarily, not usually. Most people have nasal fracture, and I've dealt with hundreds of nasal fractures, don't have neck injuries. But if you're asking, could you have a neck injury from something where you hit yourself? Yes, you could.
Doctor, let me ask you this question. To a reasonable degree of medical probability, can you testify that Mr. Maurizio did not injure his neck from this fall?
You would have to define what you mean by injury. He didn't have any significant injury. He didn't have any changes that's causing a long-term pathology. I'm not arguing that if he says a couple days later he started having neck pain, then he may have had some exacerbation of some degenerative changes, and that is then an injury. If you're including exacerbation of degenerative changes as an injury, then I think he could have had one. I'm just telling you that his initial presentation is not one of anything significant about the cervical spine, that his neck was supple, that neurologic exam was intact, and that what we see is long-staying degenerative changes, that he may have had some possible soft tissue injuries or exacerbation. I'm not stating that that's not impossible at all. If he did, then some treatment for a couple of weeks or a couple of months, some therapy would be fine. I'm just stating that he has no long-term cervical pathology at this point that's due to that event.
Dan, how are we doing the time on the tape there?
Total time, hour and 10 minutes.
um,
We're at an hour and 10 minutes, hour and 9 minutes.
okay, no problem. Doctor, Mr. Maurizio told your historian and you that he felt paralyzed upon hitting the ground, did he not?
He stated that, yes.
Did you review his deposition testimony?
I'm looking because I don't recall, it's, unless I listed it somewhere, I don't recall seeing his deposition, so sitting here right now, I don't think I have.
Have you reviewed any deposition testimony in this case?
No.
How about any discovery materials?
I've given you a list of everything I've reviewed, so what if that's from discovery materials, then it is. I wouldn't know.
In terms of going back to dermatomal deficits, what did you do exactly to determine if he's got any or not?
Well, do standard orthopedic, exam, which includes looking to see if there is any kind of specific deficit. That would include loss of sensation in the dermatome, reflex changes, girth changes, weakness, atrophy, what the complaints are. So we check for all that to see if there is a specific focal or dermatomal deficit.
And you only felt with your fingers, true?
I checked his sensation. It's not what I feel, it's asking the patient. They're much more aware if they have intact sensation or not. So you ask the patient and then give them a chance to describe if they are feeling any losses of sensation or difficulties.
Isn't the standard of practice call for using a safety pin or a pinwheel?
No.
You didn't really do an adequate exam, doctor, isn't it true?
I did a very adequate exam, the standard orthopedic exam, to see if they had any other ongoing pathology.
Dr. Magarian was here to observe the examination. Do you recall her?
I know that there was someone that came with him.
According to Dr. Magarian, you didn't do the Hoffman test, doctor. As you sit here today, did you do the Hoffman test?
Yes, I would have checked, especially if there is any myelopathy, and state that Karen McGarion's been here for multiple exams. She's very nice, I like her, but it's not like she notices every single thing. Quite often she has her head down, she's often taking notes, she's doing many, many things, so state that I don't know that she would be able to do a complete one. Also, I don't believe you call her doctor, but as far as I'm aware, I think she's a chiropractor, so I'm not even, most chiropractors aren't even aware of a lot of the tests that we do or what they're about. They have their own separate type of field, so wouldn't necessarily be a person who would necessarily even know.
You don't consider chiropractors to be doctors?
They're a type of doctor, they're just a different type. They believe in adjustments, they believe in therapy. I think chiropractors are great. I send people to a chiropractor to give therapy and exercises. I don't send them for an evaluation, but I certainly send them for, as a therapist, to give them massages, hot packs, teach people posture, body mechanics. I've hired a number of chiropractors. I developed a physical therapy program for 2 hospitals. I'm well aware what chiropractors do. I can tell you they don't do exams, they don't determine what it is, but they do treatments, and I use them. I like them many times.
Is there a reason why your report doesn't say that you've conducted the Hoffman test?
Doesn't say lots of things that I would conduct. If things are positive, I put it down. It's not going to say everything. That test is by itself is meaningless, whether it is or isn't positive. I mean, if he is positive at this point, it'd be fine. It wouldn't be related to the events of September 2011, so it's not an important point for me either way. He's not doesn't have significant myelopathy when I saw him, but he does have some stenosis, and he could in the future. Just whatever he has isn't due to the events of January 2011. So if you wanted to do that, you go back to the ER where they would evaluate things, see if whatever he had any myelopathic changes then, which he didn't. So that's the important one.
Are you aware of any other trauma that Mr. Maurizio may have had that could be attributed to his current conditions?
Well, I'm not saying any trauma is related. You're trying to ask if there's other trauma. I mean, I know that he had the other syncopal episodes and things, but I'm not aware of anything else, and I'm not saying his condition is traumatic, so I'm not trying to find some other trauma.
In your opinion, is he a surgical candidate right now?
No, I wouldn't recommend surgery for him right now.
You wouldn't recommend discectomy or fusion surgery for him?
Definitely not.
Doctor, I'd like to remind you that you're under oath and there is a standard of professionalism here. And if you want to end this deposition now so you can be represented by your own lawyer, I can end this deposition now and we can reconvene. Do you want to do that?
Yeah, you're just trying to be sort of belligerent. Patient did not have indications for surgery when I saw him. I wouldn't recommend surgery. Doesn't have the proper ones. If he had surgery, if he needed, I would say he needed it. I just would say it wouldn't be related, so it wouldn't make any difference to my opinions. If I thought he had surgery indications, I would state them. I would also state if I thought they were due to the events of September 2011. He didn't have indications for surgery that I would recommend surgery. I can tell you 100% if he is a relative of mine or a good friend of mine and he came to me, I would tell him not to have surgery. So that would be absolute. So I would not be recommending surgery, nor does he have an absolute indication or a need for surgery. 1, 2, even if he ever does need surgery, it isn't due to the events of September 2011.
Doctor, you have zero basis for that opinion, isn't that true?
Again, are you just making things up? Because you know I have a basis, basing it on what the proper indications are for surgery, what the American Academy of Orthopedic Surgery says, what the proper, why you do surgery. I'm the one that evaluates people and decides if they need surgery. I often send people and have them do surgery, or I do surgery on them all the time. That's what I do. He does not have an indication at this point that I would ever recommend surgery. And he does not meet the criteria for requiring surgery. And he's 68, right? That means he would have qualified for Medicare, right? So if somebody believed he needed surgery, they could have done surgery in the last 3 years. So if you're telling me that some doctor absolutely believes he needs surgery and it's wrong not to do surgery, how come they haven't booked him for surgery?
How do you know that they haven't advised him to have a surgery?
Booked him, done the surgery. If you're saying he urgently needed surgery, to this point, you're saying so somehow he's managed to make it all these 4 years and hasn't had the surgery, when you're trying to imply that he needs surgery with all your rhetoric and you're throwing fancy words, ask if I need my own attorney, which is just belligerent on your part, but he has no indication that I would say that he requires surgery, and clearly on exam he doesn't need surgery. And if he was a relative, a friend, or any very good person or private patient, I would not be advising him to have surgery.
So you would be okay if I were to send this videotape deposition along with Mr. Maurizio's MRIs to American Academy of Orthopedic Surgeons, and you would stand by those opinions that he doesn't need surgery, true?
Absolutely, you don't operate on an MRI, you operate on findings. And these are the same MRI findings he's had for the last 3 or 4 years. So by your logic, that means they should have been doing surgery 3 years ago, in which case, if that's true, and I disagree with you, then you'd have a malpractice case. The guy should have had surgery 3 years ago, because otherwise he gets progressively worse. So by your logic, whoever then didn't do surgery 3 years ago is doing something bad to the patient. Your logic
Is it up to the
makes no
doctor to do the
sense.
surgery or up to the patient to accept to go through the surgery?
Well, it's up to the doctor to decide if they need it,
Okay.
and a qualified doctor, and then it's up to the patient to decide if they want to have it.
All right. The records that you've reviewed, have you seen any recommendation for surgery?
I would have to go back and look what it is. I think people have mentioned surgery or talked about surgery. I don't know if it's exactly who they are. I certainly, as I said, I wouldn't recommend surgery, but I'd have to go back and look through each one to see if anyone, what they may or may not have said.
Well, this is my only opportunity to take your deposition, so I'd like you to go through the records and tell me if any doctor made a recommendation for a surgery.
As I tell you, I know that somebody has said that. One of the ones later was that Ubikoff, I think, talked about doing surgery,
Okay.
but I would disagree with them.
Did Dr. Tauber indicate that surgery is needed?
You'd have to go look through Dr. Tauber's records. His records speak for themselves, so again, you're trying to ask me by my exact recollection, and I'm not going to go by that.
Well, you have your report in front of you, why don't you look at it?
For my report, I don't have his records, so if you want to give me his records back and you want to take the time for to go through it, again, now you're just wasting time because his report says whatever it says, and I'm not disagreeing with he says it.
There it is, Dr. Exhibit 3.
Okay, if we're going to waste time, then I'm really being very nice, not, going on and not seeing patients and doing this. I consider this now just wasting my time because I've accepted whatever the record says. Asking me to look what the record is, would you know it is, read in what he says, is a waste of our time. So I will stop the deposition now if you're just going to be wasting time. I'm here, staying late, at your request, trying to be nice and benefit you. So I'm going to stick to questions that I can answer for you. You having me read another doctor's records in what I'm accepting, whatever he says, and I've already given you my opinion, is a waste of our time. So if we're going to do that, then I think we should conclude the record, the whole deposition, we can take it up later.
Doctor, you are testifying under oath that Mr. Maurizio doesn't need a surgery.
I'm testifying oath, in my opinion, I would not be recommending surgery. That's my opinion. Now, to the extent other doctors may have their opinion, that's fine. I'm testifying that in my professional opinion, after doing an exam, after looking at the actual films, after reading the records, I personally would not be recommending surgery. 1. 2, if he ever did need surgery, which can be other opinions, other doctors do it, it wouldn't be due to the events of 2011. 3, many doctors recommend surgery. The American Academy of Orthopedic Surgery says the majority of spine surgeries were probably unwarranted. That's by the Academy. So the fact that you can pull up a doctor who recommends an unwarranted surgery, statistically, per the American Academy, the majority of surgeries were unwarranted.
What's the name of that study?
American Academy of Orthopedic Surgery, Orthopedic Knowledge Update.
Orthopedic Knowledge Update? That's
It's a book
it?
published by the
No
American
number, nothing?
You would have to look up what it is. It's published by the OKU, American Academy of Orthopedic Surgery.
All right, I'll take that wild goose chase at some other time.
It's not a wrong
The
goose
MRI
chase. It's
report-
it's what they state.
Well, you're not giving me the report number or the citation or any
Do
information.
you really
to find
believe,
that
again, we're
study.
wasting time, because do you believe that I have a photographic memory for everything I know what it is? So
Exhibits are in front of you, doctor.
now we're just wasting time again. So, do you have an orthopedic question of any type for me?
Are you aware that every orthopedic surgeon that Mr. Maurizio consulted with recommended surgery for his condition?
Again, it wouldn't make any difference to me. You're asking my opinion. Would I recommend surgery? The answer is no. Whatever other doctors, the other point would be,
This is a different question, doctor. Simply, are you aware that every orthopedic surgeon that consulted with Mr. Maurizio recommended surgery, yes or no?
Objection assumes facts, not an evidence.
I wouldn't know what other surgeons he might have seen. I only see the ones his attorney sent. He could have seen other doctors that he doesn't tell us about that certainly didn't recommend surgery. I grant you that whatever ones that you or whoever attorney sent him to said surgery, I grant that. I have no idea if he may have seen much better doctors that weren't sent by the attorney who then evaluated him, but I can tell you my opinion. And to the extent other doctors have a different opinion, they can try to rationalize their own opinion.
Dr. MRI report shortly after this accident says that he had a cervical stenosis with myelomalacia. Do you recall that?
Yes.
And myelomalacia is a pathological term referring to the softening of the spinal cord. Hemorrhagic infarction, of the spinal cord can occur as a sequel of acute injury. Would you agree with that?
First of all, two compound question, but if you're asking, can you get acute traumatic hemorrhage of the spinal cord from a traumatic condition? Yes, people have that and die from that. So, and I've seen that, motorcycle accidents, car accidents, I've seen lots of people die from neck injuries. And yes, they had a traumatic hemorrhagic condition and they are dead or paralyzed. So if you're asking, can it occur? Absolutely.
And the same MRI report basically says he's got a grade 1 retrolisthesis, correct?
Yes, he does.
And retrolisthesis is caused by injury and resulting instability of the connecting soft tissue, especially ligaments, discs, muscles, tendons, and fascia, correct?
No, the majority of retrolisthesis is part of the degenerative process. As the discs dry out and they get narrower, the supporting structures become looser and you get a little forward or backwards displacement. So the number one cause of retrolisthesis is part of the degenerative process. Now, if you're asking, could you have a fracture or something else that causes a traumatic retrolisthesis? Yes, you could. That is another one. Rare compared to the degenerative ones, which is the vast, vast, vast majority, but there are other ones that can occur.
Doctor, I think you already answered a question about myelopathy that could be caused as a result of trauma, yes?
You can get myelopathy as a result of trauma. That can occur, yes.
Okay. Madam Court Reporter, did we attach the orthopedic expert opinion and testimony and expert witness affirmation statement as exhibits?
We did not.
If we did not, then I'm going to add this to as number 8 and 9.
I think I have it as 9
Right.
and 10.
Okay, 9 and 10. Thank you very much.
And which is 9 and which is 10?
9 is the standards of professionalism, orthopedic expert opinion and testimony, and 10 would be expert witness affirmation statement.
Okay.
I'm going to wrap up in about 5 to 10 minutes, okay?
That'd be great, thank you.
Now, your report says that Mr. Mauricio told your historian that he was having problems with his right shoulder, but then he discussed them with you and he stated it was his left shoulder.
That's correct. Just wanted to make it clear, because the reason one says right, and I don't want people to say whether it was that. I asked before, so I just want to make it clear that I believe it's his left. So I'm making clear that when I was in the room, he said left, but I don't change the.
Do you have a copy of the recording of the examination?
No.
I listened to it last night and he actually indeed complained of both shoulder problems. Is there any reason why you felt that you needed to comment the way that you commented in your report? That he only complained about his left shoulder?
Because when I came in, what was listed by the historian under body parts of current complaints is right shoulder. What was listed under the current complaints was right shoulder pain, travels to right arm, etc. When I then said, oh, so you have pain in your right shoulder, he said, no, it's left. So now he changed it to left. So the thing was, he gave, now I'm not gonna go then change the history because the historian clearly wrote it down right, and I checked with the historian afterwards to say, you know, he said left, and she was very clear that no, she believed he said right. So what I'm saying is, whether he was confused or whether he missed right versus left, I don't know why he said to the historian it was right shoulder, right arm, and then he said to me left shoulder, left arm. So I just made the note of that because I don't want it to be that I'm trying to say something different. I can only tell you what he told me, and I can only tell you what evidently he told the historian.
But if I were to give you a copy of the recording where your historian will be proven to be wrong, are you willing to amend your report then?
Confession calls for speculation.
If you say, if there's recording that says no, it was right shoulder the whole time, I mean left shoulder the whole time, you never mentioned right, that'd be great. I'll just change it, make sure everything left. It won't change in my opinions, but I'm very happy to do that. So yeah, that'd be great. Send it to me.
Has your historian ever made such errors before?
Well, you know, I doubt that anyone's perfect, so they could make a difference. That's why I check everything. I review very carefully the entire history of everyone, and so to the extent that whether they're wrong or people recall things differently, yeah, there's quite often I make changes versus when they say a year was or a date or what happened. So I'm not saying anyone's infallible. What I'm saying is I clearly got the history of the left. I'm proceeding forward that it's left. Now I know that he said to me when he said about right, he goes, I can get some similar, more mild on the right, and I've noted that. So my history is that it's predominantly left shoulder, whole arm, bothers with activity, sometimes sleeping, that it's sometimes similar, more mild pain on the right. That's the history I obtained, that's the history I'm proceeding with, that's what I would be testifying for is the history I obtained.
Doctor, are you aware of the costs of surgical procedures, like for example fusion surgery, cervical fusion surgery? How much does it cost, say, in LA market?
In LA or throughout California, it's about $35,000-$40,000 for it's a standard cost for a cervical fusion.
For the surgeon's fee?
No, entire thing. Surgeon fees of $2,000 sometimes, maybe $2,500.
Do you have any privileges in any of the hospitals locally?
Sure. Cedars-Sinai, Silver Lake, Miracle Mile.
Were you aware that Cedars-Sinai charges $140,000 for fusion surgery?
They may charge whatever they charge. What it costs, what they collect, and what they, receive is about $35,000 or $40,000, which is what the cost is.
So you're sure that that's what Cedars-Sinai receives, $35,000 for a fusion surgery?
On average, yes.
How do you know that?
Well, I've seen quite a few of their billings. I've seen what people pay. I'm well aware of what Blue Cross, Blue Shield, Workers' Comp pay. I'm well aware of National Institute of Health Studies of what things cost. I'm well aware of all the literature on what does it cost to get a fusion surgery throughout California, but also, in this market, which is essentially the same. LA doesn't cost much more than San Francisco or anything else. They're all about the same as far as, because almost all of them are paid based on schedules. So I'm talking about what the cost is, and meaning what the reasonable cost would be to procure that kind of treatment, or what people would be paid, or what it is in the marketplace, or what even the major healthcare providers pay for something.
When was the last time you had an encounter with such, say, studies or billings that you remember seeing $30,000 to $35,000 for a neck fusion surgery?
It's actually mistakes testimony, you said 35 to 40.
Yeah.
Okay, 30% corrected. Thank you, Counsel.
Oh, in the last few months, I've had ones where people have asked me. I've gone, looked again, and updated different ones. So I'm always aware. I'm always looking at the studies. I'm always get a lot of literature. I look at what things are. So I update it as it goes along. So I'm pretty aware of what costs are.
Are you talking about single level fusions here, 35,000, 40,000, or more than single level fusions?
Well, it's for a fusion. If you have another level, it's going to be another $2,000 to $3,000 more. Overall, most of the cost is already the same. Adding on another level only takes another 20-30 minutes, so it does add in a certain amount, but it doesn't make it. It's not like it doubles it. You're only adding a small percentage increase for each level.
For the sake of accuracy, let's say between C4 to C7 fusion, what would it cost?
first, I wouldn't be recommending a multi-level fusion like that. It really causes higher problems. But if you get into higher levels, then you can end up adding on another, as they said, 5,000 or so per level. So if you're going to go 3 levels, you'd be adding on another 10,000 or something beyond what the single level. But I wouldn't be recommending that.
45 to 50,000 then?
It could be, yeah.
Okay. How about the spinal cord decompression surgery?
Well, that's all. Now you're saying you do spinal cord decompression as part of the fusion, so it's not a separate one now. That's part of the over one. Now, if you're saying you're not going to do a fusion, you're just going to go, for instance, do a laminectomy. You're going to go posterior. You're not going to do a fusion, which we do sometimes. That costs less because you don't have to put the implant, the grafts, the things. So it's an easier procedure, and so that costs less.
Well, let me take this out of Dr. Obukhof's report. He says he would require urgent surgical treatment from C4 to C7 spinal cord decompression, discectomy, and followed by fusion. Now, if this were to be done, would it be done in one operation or multiple operations?
Well, first, we're talking, of course, about something I'm not stating he needs. So, but if you're talking about hypothetical now, it depends on the indication. Sometimes if people are talking about more just myelopathy, they'll just do a decompression. Japanese get a certain condition, and sometimes where they get congenital stenosis and this thickening of the ligamentum, and so you end up having to do a long level decompression from the majority of the cervical spine, and you don't fuse them. You just do a posterior decompression. Other times you do anterior. Are you asking, can you do them in the same sitting? Yeah, you can do one and then put the patient over and then fuse it, or vice versa. So if people so wanted to, wouldn't be recommending that again, but as a hypothetical, yes, you can do it in one big sitting if you wanted to.
What would be the standard practice in this type of operation?
Well,
To do it in one sitting or to do it more than one sitting?
Well, there is no this type. It's based on individual ones, what you're doing. And so it depends on how severe the myelopathy is, how urgent the decompression is. Depends on a whole bunch of factors. So you do it on a case-by-case basis.
Well, we know the severity of Mr. Mauricio's myelopathy, do we not?
In that it's not severe enough that I'd be recommending a warranting surgery, that's correct.
Okay. Now, if we go with Dr. Obukhof's recommendation here, C4, C7 spinal cord decompression, discectomy, and followed by fusion, would it be done in one setting or more than one setting?
I already answered that. Depending on its individual case, you can do it either way. So people can make a choice based on a number of factors of how and when, why they want to do it.
What would it cost if you do it in one surgery?
Probably adds another $10,000 or so to do, try to do everything.
$55,000 to $60,000.
Good.
Okay. How about if you do in 2 operations? What would the cost be there?
Well, it depends. Then you're going back to having 2 different surgeries. So then you're talking about, having 30 to, 40,000 at one time, because one or maybe less. And so you're doing 2 different surgeries. So you're going to have, would cost more to do it in 2 different
So double it basically.
settings. No, well, the laminectomies cost much less than fusion, so it doesn't double it. But you'd have 2 different settings.
So the first one will cost about 40 to 45.
Could, depending, and the other one could cost less, so more like 30,000 or so. It just depends. There's a number of factors.
September 19, 2012 MRI conclusions state there's a 1.4 centimeter length of myelomalacia from the C4 to the C6 level secondary to severe central canal stenosis from diffuse disc bulge and disc osteophyte complex. Number 3, it says, number 4 actually, it says the extent of the myelomalacia appears more focal compared to the prior examination, with cystic changes spanning 1.7 centimeter in length. Given these findings and also the complaints of numbness, tingling in his arms, radiculopathy, as well as his unsteady gait, would you agree that Mr. Mauricio is a surgical candidate?
We've already discussed this. I've already given my opinion. No. a number of reasons why he could have numbness and tingling, there's a number of reasons why he could have unsteady gait, there's a number of other findings. So, again, I already told you, I would not be recommending surgery on Mr. Maurizio.
Can you testify to a reasonable degree of medical probability that Mr. Mauricio had a significant pre-existing condition, and if so, what is that condition?
Well, as I said, I can tell you that the findings in the MRI are not of any trauma due to events prior to 2011. So, to that extent, the findings are there of long-term pathology, and that none of the findings there are due to the specific event in question. But I'm not aware of any other medical records, or maybe looking at any other representation other than that.
And there's no record, medical or otherwise, to show that Mr. Mauricio had any neck problems or pains before this accident, true?
I'm not aware of any prior medical records, that is correct.
He was asymptomatic, correct?
I'm not aware of any medical records, as I said.
And the trauma could make someone who's asymptomatic, even though may have some pre-existing degenerative condition, to become symptomatic. Would you agree with that?
There are traumas that can make you symptomatic, that is correct. Not in this case, but I believe it's related, but there are traumas that can make you symptomatic.
You don't consider Mr. Mauricio's fall from 3-foot high area not to be severe trauma?
Well, he broke his nose, so by definition, I guess that's severe to his nose, but no, on an orthopedic basis, he did not have severe trauma. When you talk about his presentation, both by the paramedics in the emergency room, that doesn't qualify anywhere near what I call severe trauma based on all my years of working in the emergency room and telling you what severe trauma is.
To your knowledge, he has never complained of any numbness, tingling, unsteady gait, any shoulder issues, any weakness in his arms or legs, any radiating pain in the buttocks, in legs, in toes prior to his fall, true?
As we've already said, for what, the fourth time, fifth time now, I'm not aware of any prior medical records and won't be stating anything about any prior medical records.
What type of treatment is available to someone like Mr. Mauricio who got all the symptomatology and pathology?
Over the broad question, because I don't know what symptomatology you're talking about. Is polyneuropathy, is degenerative changes? I don't know what you're talking about, but as we get older, we all get symptoms. He certainly has some symptoms. He certainly has polyneuropathy and a bunch of other changes. Unfortunately, as we get older, that's not that uncommon, but you have to be a little more specific about what condition you're talking about.
All right. Have you asked for any additional materials from Mr. Sawyer?
I haven't, but now that you tell me about there was depositions, if there is a deposition, I'd request that. If there's any depositions of any of his other doctors, I'd request that. If there's been any further examinations by any of the other doctors, I'd request that.
But as you sit here today, up until this point, you have not asked Mr. Sawyer to give you any additional materials, true?
I wasn't aware of any, that is correct.
Okay, all right. If you receive additional materials and formulate further opinions and fail to disclose those opinions in advance of trial, I will move to exclude those opinions, Doctor. Do you understand that?
If I do receive any further records, and I will be happy to issue a supplemental report, and if I change any opinions, I will so delineate that.
And I shall reserve my right to meet with you again to go over those opinions.
That would be fine.
Okay. I think that's it.
That'd be very nice.
All right. Mr. Sawyer,
Sir,
any questions?
none.
Good. All right.
He needs to leave.
let's stipulate to relieve our court reporter under, from her custodial duties under the code. She'll prepare the transcript and send it to
Me.
Mr. Sawyer's office, where, let me ask you, Doctor, are you waiving signature? The trial is on the 24th.
I'll be happy just to make it easier for you guys to waive signature, as long as they can send me a condensed copy, along with all my records and everything else you're taking from me.
I'm sure that Mr. Sawyer will arrange for that. Will you send him a condensed
I'll
copy?
ask him.
Okay, the transcript will be sent to Mr. Sawyer's office, where he'll either obtain the waiver of signature or provide condensed copy to the doctor, and should the doctor make any additional changes or opinions, then we shall be informed of same, maybe 5 days before trial?
How about a minimum of 3 days before the witness takes the stand? I don't know when I'm gonna get this.
Okay, all right, agreeable. So the doctor is waiving signatures, just to be clear. Okay,
I will waive signature.
all right, sounds good. And that Mr. Sawyer will produce the original for the trial in this matter and lodge it with the court upon reasonable request. And in case the transcript becomes unusable, unavailable for whatever reason, certified copy can be used in lieu thereof.
So stipulated.
Stipulated. Did I miss anything?
Yep. This completes the deposition of Dr. Robert Wilson. We're going off the record. Time is 3:33.
Okay.
Doctor, thank you very much.